Did you know that regular use of heroin can lead to addiction within just 2 to 3 weeks of using it? Now, what happens in those 2 to 3 weeks leading up to the point of addiction? Research has shown that although heroin is used by a range of people from a variety of cultural, economic, and social age groups, first-time users of heroin are typically people in their teens or 20s, and those who use heroin regularly are over 30. When someone uses heroin for the first time, they often experience nausea and vomiting, and users have reported that after these initial effects wear off, they begin to feel a surge of euphoria or rush. Following the rush, there is a period of sedation and tranquility known as being on the nod. Feelings of detachment from physical and emotional pain and a feeling of well-being have also been reported. Some other effects include pinpoint pupils, itchiness and sweating, slowed breathing, which leads some people to fall into a dreamlike state, falling in and out of consciousness. Bear in mind that all of these effects will take place from using just a little amount of heroin, depending on the dose and how the drug is used, which can be by injecting it into a vein, into a muscle, or under the skin, snorting the powder through the nose, or inhaling. The effects felt by the user generally last for 3 to 5 hours. If it is injected into a vein, the rush is felt in 7 or 8 seconds and lasts from 45 seconds to a few minutes. When it's injected under the skin or into a muscle, the effect comes on slower, within 5 to 8 minutes, and some users may be on the nod for up to an hour. Although people who use heroin only on occasion may not get addicted to it, it should be noted that it is a slippery slope after the first use because some people go on to use it multiple times a week to achieve the same effects they felt the first time. And with regular use, the body develops a tolerance, which leads users to need more of the drug, thus leading to a physical dependence on heroin. Those who go on to use it daily must use it every 6 to 12 hours to avoid symptoms of withdrawal. And once someone is dependent, stopping their use can be extremely difficult. People who have used heroin for a long time often report that they no longer experience any pleasure from the drug. Thus, they continue to use heroin to avoid the symptoms of withdrawal and to control their craving for the drug. Research shows that by the 3-week mark, a user who has used regularly becomes addicted to the drug, and they may begin to experience constipation, loss of sexual interest and libido, and irregular or missed periods in women. Now, what are the signs that show that a user has become addicted to the drug? They include trying unsuccessfully to quit or cut down, using more than planned or over a long period, giving up activities that were once enjoyable, failing to fulfill responsibilities at work or school or at home as a result of opioid use, feeling ill when opioid use suddenly stops, experiencing cravings, spending a lot of time and effort getting, using and recovering from opioids are all some sign of addiction. As with all addictions, this one comes with some nasty side effects as well, which include the risk of overdose, high risk of bacterial infections, blood poisoning, skin infections, and collapsed veins from injecting the drugs. Sharing needles also increases your risk of becoming infected with or spreading HIV and hepatitis B or C. There's also the potential for permanent organ damage to the liver, kidneys, and brain occurring from a lack of oxygen during overdoses. And chronic heroin users often have lung problems, including tuberculosis and pneumonia. Research using brain scans also shows that long-term regular use of heroin results in changes in the way the brain works. Although it is not yet clear what the effects of these changes are, it is suggested that it may take months or years for the brain to return to normal functioning after a person stops using heroin. If you got value from this video, be sure to give it a thumbs up and click on the video on the screen for more.